Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This is the one I screwed up with, Brad, because I did a video for my nephew, Will.
Oh,
and,
yeah.
It was a little too much too soon, so we're going to take it back a little bit. So,
so Will had a surgery, correct, on his shoulder?
He did not have a surgery, but he's only 2 weeks out from fracturing his scapula. So,
okay, fracture.
But this is important for anybody who's had an injury in the shoulder,
yep.
or if you've had surgery. A lot of times these are the exercises they're going to have you start out with. So it's the pendulum exercise and passive range of motion for the shoulder after surgery or after injury.
Right.
So, and sometimes with some of these, you're actually going to need help. And so if you need help, the person, your caregiver, is going to watch this video and they'll know how to do it correctly.
Right. Typically, the person is going to be wearing a sling.
Right. And that's what he's in. He's in a sling right now. And you can take you out of the sling and do these exercises in a pain-free manner.
Mm-hmm.
So, by the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us. We don't bite. It's Bob and Brad. You like us, we like you. It's positive vibes. It's hippie. It's a hippie world. All right, Brad's going to show first how to do pendulum exercises. So this is one you can do on your own.
Sure. This one is also known as Codman's. I believe it's
yes.
Dr. Codman. But usually when I talk to a patient, I say pendulum because it makes a lot more sense. Because your arm is to dangle like a pendulum, like a ball on a string, get it to relax. And we're just putting a little traction to those shoulder muscles. And you're going to use your body to get forward if you can do that, and just let it relax. It should feel, like a nice stretch. It shouldn't, create any pain, particularly sharp pain. And then you go forward and backwards. You can see as I go forward, that's bringing your shoulder forward, so that if you're standing, it was here. But don't do this if you gotta, if you're not supposed to, like.
But you started off with circles, Brad?
Yeah. Well, I'm starting out forward and backwards.
Okay. Sounds good.
Then we're going to do circles as if you had a crayon on your hand and you're going to draw circles on the floor. But get your body moving, let that shoulder relax. Typically do this 30 seconds or a minute.
And you see he went clockwise and he went counterclockwise.
Yep.
So he's covering both directions.
And sometimes you can go right to left as well, depending on how it's feeling to get more range of motion. Should be a comfortable, relaxing stretch.
And you can do this a number of times a day.
Yeah,
obviously,
for sure.
I mean, you certainly can do it at least 3 times a day.
Typically, you'll be in the sling, take it out gently, do your pendulum exercises, and then back in the sling.
And it should be pain-free.
Right.
All right, Brad's going to lay down. We're going to show passive range of motion exercises for the shoulder, both supine, which means laying down flat on your back, and also we're going to do it in the chair.
Sure.
So I'm just thinking, I said it wrong, lying down. People are lying and laying, so he's lying down.
We get caught on that a lot.
A lot.
We've got a lot of English majors.
Yes, we do. So now I'm working on this side, on his right side. If I was working on his left side, what I would do is I would move the pillow over like this. So now there's room here for the shoulder to move.
Yeah.
So since I'm going to work on this side, I'm going to move it over this way. So now there's room over here for the shoulder to move. Now, generally what you're going to do, you're going to have 2 handheld placements here. I like to grab one above the elbow and one right by the wrist.
Yep.
So, and this person needs to relax. They have to trust you, and they have to know that you're going to do all the work. So,
which is not always easy to do.
No,
there's very protective of the sore shoulder.
There's people that'll help you all the way up, and a lot of times I do a little bit of shaking like this then to try to help them relax. So, and if they still don't relax, then I take the hand and I slap them a little bit. No, I don't do that, honestly. Okay, so, all right, relax, Brad. So I'm going to go ahead and I want thumb going up.
Yep.
Okay, so thumb's going to go up, and I'm just going to gently bring it up. You go up to the point where he starts to feel the pain, and then we back off a little bit.
Oh, right there.
Yeah, right there.
So the thumb goes up because that positions the humerus up here in a more freer position for range of motion.
Right, it's not going to impinge as well.
Yes.
Why don't we do internal and external rotation right now? So what I'm putting his arm like at a right angle like this, 90-degree angle. And I'm like this, and I'm holding it. This one's a nice, gentle one. Sometimes you start off with this one.
Yeah.
Because I'm just going back and forth. I'm maintaining the right angle. But this is internal and external rotation. Real important to have these. Again, go within what he can tolerate or she can tolerate.
Right. And really be careful of going out
Right.
is where it's most
It's
vulnerable.
probably going to more likely to hurt going out like this.
Right.
So that's the second and third exercises, I guess,
Yeah.
internal, external rotation. And the last one, again, you're going to thumb is going to kind of go up. So I'm going out this direction here for a little bit of abduction. So if I show you on me, I'm going like this, my thumb's up, I'm going out to the side like
Sure.
this. So, and again, all passive, meaning that you're just relaxing, Brad. You're doing a good job, Brad.
Oh yeah, thank you.
You're a good boy.
Should be pain-free.
Pain-free.
So typically, the higher you go, it may be stretching a little bit. Watch the person's eyes, because sometimes people start to squint before it hurts. And
Yeah, that's what we always cue in onto their face
Sure.
of what they're doing. We can do it in the chair here too, Brad. We can show how you can go ahead and. So again, with the shoulder, why don't we turn this way?
Yep.
There we go. And I'll bring a chair over. You got matching chairs.
Yeah, that's nice, Bob. It's you know, really people notice that.
Yeah. So again, we're going to work. I would probably start with internal, external
Yep.
rotation here. Real simple.
See how he's maintaining my elbow,
Yeah.
so that's the fulcrum point, or the pivot point, I should say. And we're just doing some gentle motion. This is really doing a lot for that rotator cuff. It doesn't look like much, but you know, if someone's got a sore shoulder, when you get out this way is when
You're going to start to feel it.
Yep, those eyes will open up if it starts to hurt.
And then again, I'm going to work on flexion, going straight up. Again, I got my two hand holds right above the elbow and right by the wrist here.
Now, sometimes on this, I'll find going up goes pretty good, but going down, people will try to
Help out.
and then they get a little pain.
Sometimes what helps with that, Brad, is to actually bend the elbow like this and go down.
Oh, sure, yeah.
It helps them relax. So sometimes you
Yeah.
bring it up like this, bend the elbow, and then go down.
Right.
It just seems to relax them a little more. And the final one again, we're going to go out to the side here, thumb up again. And again, I get up to this point, maybe it's a little sore, I'll bend the elbow and come down.
Yep. You know, these are all little secrets and tips that we've learned as therapists over the last 20, 30 years, and we're letting you know them, so we're passing them on.
We're passing on the pearls to you.
There you go.
You know, it's like passing on grandma's pearls to her heirs.
Okay, Bob.
All right. Thanks everybody for watching.